Irma Cota has headed up North County Health Services since 1997.
When I got here, the budget was $12 million, and now this year's budget is $68 million.
Cota's staff has grown from 200 to more than 700. A network of 11 community clinics provide access to health care for more than 60,000 patients all over North County. But Cota has come a long way from her childhood in Calexico to reach her corner office.
I often tell the story that, first of all, we grew up with a single mother who worked in the fields, and so as soon as we were old enough to work in the fields, we started helping our mother on the weekends and in the summer. So it was depending on the season. We did, carrots and broccolini in the winter time, to onions and garlic and tomatoes in the springtime, and then in the beginning of June, we would make our trip to Salinas, primarily to pick strawberries. The summer between my sophomore year and junior year, my sister had graduated from high school and gotten a job as a bank teller, and so my mother chose not to make the trip. So I was sent off on my own to Salinas to work side by side with my aunt in the fields. And early, like within weeks of my working, the United Farm Workers went on strike. During that experience, I found out that the farm workers had a free clinic, and it piqued my interest because they were saying we need interpreters. And they asked me if I would be interested, since I was being the interpreter. And so that in the afternoons, and then once I got back to work because the strike ended, I would volunteer 2 nights a week at the free clinic.
When Cota returned home to Calexico, disaster struck. Her mother had a health crisis, went to the hospital, and was diagnosed with terminal cancer.
She was diagnosed, like I said, early November, and she died in May. The following May. So for the 6 months, I was the one that helped take her to El Centro via the Greyhound bus. We didn't have cars, and walk. I mean, so I could just almost try to walk on her shoes in terms of having the pain and having to walk the distance that we had to walk to get her treatments at the El Centro Hospital. So I was her interpreter and her support system, as well as giving her, her painkillers. So the experience of my mother having this sudden health crisis that our family faced, together with my experience with the farm workers clinic initially, and then subsequent to that, my continuing experience is what I feel gave me my career. So I feel fortunate, actually, having come out of those crises in a way that I could have a future in healthcare.